The beauty scientists, Dr. Kristy Hamilton and Dr. Kim. Real beauty without the hype.
First things would be to optimize your health. So we are, of course, assuming that you're a medical candidate, that you can tolerate the surgery, you can tolerate anesthesia. But the important things would be to stop smoking before surgery. Some plastic surgeons won't even operate on you if you're smoking at all. We definitely recommend stopping like a month ahead of time or something of that nature. Stop vaping/smoking. And the other thing is avoid blood thinners because, of course, we know about aspirin. You may be on blood thinners for your heart condition. However, omega-3 supplements and anti-inflammatories, NSAIDs, non-steroidal anti-inflammatory drugs, NSA, aspirin, Motrin, ibuprofen, Aleve, things in that chemical family definitely cause increased bleeding.
Yes, and these medications, they can be hidden in some of your other ones. So if you're having headaches or something leading up to it, I tell patients Tylenol is safe. But you'd be surprised how even a lot of these supplements that patients are taking, garlic, ginkgo, there's so many of them that can cause bleeding complications. So I actually ask my patients to stop all of their supplements 2 weeks before, and then we give them a specific list of medications to avoid. But that's one way you can help limit your bruising after surgery so you can get back to your activities as quickly as possible. Smoking is so key, and I'm glad you mentioned vaping and really all the other forms. So people will come in, they'll be like, oh, it's great. Like I haven't smoked for years, but I chew the nicotine gum. Well, for our purposes, as plastic surgeons, unfortunately, the gum is really almost just as bad as the cigarette for us because that nicotine is what squeezes all your little blood vessels very small and stops the nutrients and oxygen from getting to the edges of the incision. So as your sutures dissolve or after we remove them, if you are secretly or not so secretly using nicotine products, then we'll see things just fall apart. And you don't want that. And we don't want that. So that's really, really important. What other things can we do to optimize healing heading into it?
I think another thing is optimizing your diet ahead of time. So you want to make sure that you're eating protein beforehand, and we'll talk in a moment about eating protein after surgery. Another thing is actually marijuana. So I think, weirdly enough, vaping marijuana maybe isn't great, but it's probably a little safer than actually smoking marijuana. If you're smoking marijuana, you're getting a lot of tar, you're getting smoke, and it actually has a similar effect to actually smoking tobacco. I also think that patients who use a lot of marijuana may need extra anesthesia, have a lower pain tolerance, or possibly just need to sort of back off if they're consuming a lot. It's hard to define a lot. To me, a lot is like you're puffing every day. You need to cut back a little. And weirdly enough, if you're just an occasional CBD or a marijuana user, it may actually calm you after surgery.
Yeah, and it's just important to be very transparent about any of these other substances you might be using with your surgeon, as well as your anesthesiologist if you're having general anesthesia, because it can impact what medications you're given, and we can often adjust things to make sure that you're safely taken care of. The protein intake that you mentioned, I think, is so important. It's the same reason why I have patients stop the Ozempic and Ozempic equivalents leading up to surgery. We don't want you in this starved state when we're about to create large, hidden, but still large, like surface areas of wound healing. So it's very important that you're eating great lean proteins, healthy diet, because afterwards also, oftentimes people aren't very hungry after surgery until they get kind of back into their routine. And so I tell patients, you're going to probably lose some weight anyway. So this is not the time. We want to make sure that you're eating enough so you have good protein building blocks to heal all of your incisions.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.